Hi, I'm Deborah,
And I'm Lawrence.
and today we're going to talk about some myths about depression. One of the problems with depression myths, there are a couple problems. One is that when people don't understand depression or have misconceptions about it, either they don't get help for depression or if they know someone who has depression, they misunderstand it, maybe, don't
Spreading,
recognize it.
and yeah, they're probably going to be spreading this, I guess you could call it disinformation, but they don't really know better because this is just,
Right,
yeah, but
right.
they could be spreading that to other people who are, that circle of people who are going to be either telling depressed friends these things or if they're depressed themselves, they're believing these things.
Yeah, one of the biggest problems with any kind of mental illness, and it contributes to the stigma, is lack of information or misinformation. So we wanted to go over a few myths about depression, and talk about them, and in general why they're wrong or
Yeah,
silly or foolish or something,
whatever you want to call
whatever
it.
you want to call it. The first myth we're going to talk about is the one that depression is not a real medical illness. Now, clinical depression for everyone, depression is different. It's got different causes, different triggers. But the facts is that there are differences in the brains and in sometimes bodies of people with depression that aren't present in people who don't have depression. Individuals coping with depression have a higher level of stress hormones present in their bodies, and the brain scans of depression patients show decreased activity in some areas of the brain. We're finding more and more as we get more and more sophisticated brain scans that there actually are differences in the brains of people with depression. The second myth about depression we're going to talk about is that if people say, even if it is a medical illness, there's nothing that can be done about it. Well, that's not true either. About depression is treatable. About 80% of people with depression can be treated to some extent. Not it won't
Not
go away
cured.
100%. It never can be cured. Okay, so when you see something saying that something can cure depression, it's not, unfortunately, not that simple. And for some people, if they've had a successful course of treatment with depression and they go off medication, it can come back. It can come back because of stress, changed circumstances in life. And the important thing also is getting treatment and getting diagnosed, because some depression is actually caused by an underlying condition like a thyroid condition. So it's really important not to just say, or not to let someone else say, there's nothing that can be done about it, because you definitely, first of all, want to check to see if there are any underlying undiagnosed conditions that are causing it, but also it can be treated. So it's really important to see a medical professional, get a official diagnosis, and see about treatment. And that doesn't always mean medication.
Yeah.
The third depression myth we're going to talk about is people saying depression is no different from getting the blues and it's just a normal part of life. Saying depression is like the blues is like saying that a cold is like pneumonia. Okay, there might be some kind of tenuous connection there,
Yeah.
but it's not the same thing. Everyone gets the blues from time to time, but usually at most for a day or so. There might be something that happens in your life.
It can get triggered by something as simple as bad weather.
Yeah, exactly. It could be a rainy day. But the fact is that those blues usually go away after a couple days. And the other thing is, no one ever committed suicide because they had the blues, just the regular blues. The other thing is that depression can last a lifetime instead of a few days. So it's not, it's not the same thing as just having the blues. It's not the same thing as being sad over something specific.
Yeah. I've been told this a few times, and it's really irritating because, it feels like they're trying to invalidate how I feel because, I'm depressed and it's not just me, being upset for a little bit. it's something that I have to deal with, and it's not something fun. And I hate hearing from, I've heard it a lot from adults, especially people saying, "Oh, you're just being dramatic. It doesn't matter. You're just sad. Stop
Or-
complaining."
I guess some people say, well, everyone feels that way sometimes. I feel
Yeah.
that way sometimes.
No, I've heard that.
And I think sometimes people are trying to connect with you when they say that. They
Yeah,
maybe mean well, but the fact is that they may have some small sense of what clinical depression is like, but it's not the same thing.
It's difficult to understand if you don't have it.
Yeah. It's not the same thing at all. And the fourth depression myth we're going to talk about is that people who have depression are just feeling sorry for themselves. I wish it were that easy. Here's the thing. Depression affects 19 million people annually in the US alone. So that's 19 million people at any one time.
Yeah, and that's a lot.
That's a lot. So that's a lot of people that are just feeling sorry for themselves. And the other thing is some of the most prominent and well-known people who have suffered from a depressive disorder include Alexander the Great, Abraham Lincoln, Theodore Roosevelt, Winston Churchill, George Patton, Isaac Newton, Stephen Hawking, Charles Darwin, J.P. Morgan, Ludwig von, Beethoven, and Michelangelo. These aren't people who basically just, can you see many of these people just like feeling sorry for themselves? Not likely. So if anyone tells you that you don't have depression and you're just feeling sorry for yourself, think about that list of people who, just made incredible contributions to history and had incredible lives, but had depression.
So with this one, I've heard this a lot, and I've heard people say stuff like, "Oh, you have nothing to be depressed for, you're just doing it for attention," and that's extremely demoralizing, and it doesn't make me feel good at all. And it certainly isn't going to help somebody who is depressed and is going through these things. It's going to make them feel awful. It's going to make them feel invalidated. It's going to make them feel like they aren't feeling what they're feeling and that they're, not being true. I don't know.
If nothing else, it's going to make them feel that they can't ever talk to the person who said this about their depression. And the more doors that are closed to someone with depression, as far as expressing themselves, the worse it is for them. Yeah. So honestly, if you've ever said this to someone, seriously rethink it. The fifth depression myth we're going to talk about is that you can will depression away if you're strong enough. If you can't just make it go away, with your brain, then that means you're weak. That you should be able to just get rid of it somehow.
Yeah, I mean, I don't know about everybody else, but I've tried real hard. My depression hasn't gone away. So, I mean, I guess in that case I'm weak, but I personally wouldn't say so, but that's maybe just me being conceited. Anyways, I
honestly had, because of a lot of things that have happened to me in my life that haven't been really good. I had a therapist once say to me that I have a spine of steel. And the thing is that...
What was that supposed to mean?
That I'm really strong.
Okay. Sorry, continue.
I thought that was kind of obvious.
No, I'm small brain because I'm tired.
Anyway, having depression doesn't mean that you're weak or you have a weak character or I don't even know, you're a wuss or...
None of that is
it
correct.
Doesn't mean any of that. Again, there are people like Abraham Lincoln, Winston Churchill, Theodore Roosevelt, who had depression. So should they have just,
Were they weak?
Were they weak? If someone says that to you, then I think you have to seriously question their definition of a strong character.
Yeah.
It's
stupid. I really think it's stupid because, who's to say that this person hasn't given everything they can to try to make this depression go away. You don't know. Whoops, you don't know that. Nobody does.
The other thing is that this is something that is not applied generally to physical illnesses. So someone doesn't say to someone with diabetes or heart disease, oh, if you were stronger, you could overcome this.
It's like, yeah, somebody with cancer, you're like, oh yeah, I mean, you can just will the tumor out of existence if you are strong enough.
Unless you're going to one of those really bad, places that,
Yeah.
But I think the problem is that it's connected, because it's in your brain, it's connected to your personality. Which it's not really. The thing is that when I was diagnosed with depression and when I had successful treatment, I found out, I'd had it most of my life, and I found out that I actually was a very optimistic person. The depression just changes your personality to a great extent. So, if you have depression, that actually that's not your personality. There was a video about this that we talk about mental illness so differently than we talk about physical illness. So in other words, if someone had a broken leg, you wouldn't say, can't you just make that go away?
Can't you just walk it off?
Can't you just walk it off? So the thing is that that's the kind of attitude that contributes to the stigma. And, that's the kind of thing that kind of attitude and that kind of, belief is what makes people much less likely to talk about having depression and also to get help. So those, that's one of the worst ones, I think. And we really need to get rid of that. We really need to stop people talking about depression that way and connecting it with a weak personality.
That's definitely something stupid that needs to not be a thing.
Yeah. If you believe it about yourself, don't.
If you believe
it about someone else, don't.
If you believe it about someone else, shut up.
Yeah, you're wrong.
Shut up.
Okay? And you need to readjust your thinking.
In any case, we hope that you enjoyed this video. If you did, you can give it a like. If you want to say anything at all, you can leave it in the form of a comment. And if you like the content, would like to see more, you can subscribe. In any case, we hope that you have a nice day.
Take care.